Okay. While you go ahead and get your stuff set up, I would like to welcome everybody to Diventures doing a series of expert talks. I appreciate you guys all coming. Today we're hearing from Dan Orr. And if you have any questions throughout, go ahead and put it in the chat. I'll be collecting questions and we'll ask them at the end. So you can ask them at any point in the chat room. And then I'm asking if you would stay on mute if you're not actually interacting. It helps with the background noise if you would help out. I'd like to introduce Dan. Dan comes to us with a wealth of scuba experience. So he has worked in a retail store. He's been an instructor. How I met him, he was the president of Dan for many years and has held many, many roles in our industry. We were talking the other night, and I think the first time I met him was around 2006, 2007, and it was at Hague Quarry, and I remember I was so excited because he had written some of the books that I learned on. So he had written some of the Dan, the O2 books and some of the guides books and stuff, the mini guides that I had learned how to dive and learned my dive master, Dan Orr, had written. And I went downstairs to my library and I found one that I had found that Dan had inscribed to me a couple of years ago for me. And so definitely somebody who's been in our industry for a while and definitely influential. I'd like to introduce you to Dan Orr, and he's going to talk to us tonight about if scuba diving has a retirement age. So Dan, thank you for joining us.
Hey, thank you, Joanne. I really appreciate it. Let's see, now what do I need to do? Are you still, can you see my title slide?
Not yet.
Okay, because actually I see you only.
You should be able to at the bottom. Can you sit, you're gonna have to share your screen again.
Again. Okay, let's see that. Okay, how's that?
It's coming, there it is. Yep, there it is.
Very, very good. Thank you very much. I appreciate it. Thank you for the introduction. The title of this, of course, is Scuba Diving Have a Retirement Age. And to give you an idea of the genesis of this presentation, when I was the president of Dan, I got a call from an irate member who was very, very upset because she had been told by her family physician that once she turned 60, that Divers Alert Network said she could no longer scuba dive. And she was very upset. And so when I talked to her, I got her calmed down and I said, do you have any idea why your physician said that? Do you have any health issues? And she did not. And I said, okay, fine. What we will do is we'll take care of it. What we'll do is we'll have our medical department call your family physician, talk to your family physician to see what the issues are and try to clarify the situation. Well, it turns out that her physician had read a couple of articles, one of which was from Divers Alert Network, that talked about the fact that there were some issues that you needed to be aware of as you age that could affect your risk. And so it said nothing at all about any particular age barrier, but the physician, to be kind of safe, decided to err on the side of caution and told her, out of his own interpretation of that article, that she should stop diving at 60. Well, after talking to the physician, then he realized that there is no age barrier, that as long as you're in good health and you have no issues that are contraindications to safe diving, you can really dive as long as you want to and do it safely. And you may have to make some modifications, as we'll talk about as we go through this presentation. So as we go through here, hold on a second, let me make sure everything is working. Just to give you an idea of the diving that I've been doing since I turned 70, I'm 72 right now. But since I turned 70, I've been diving in the Antarctic. I've been diving in the Arctic, in Greenland, in Argentina, the Philippines, Guadalupe Island, Mexico, which has the largest resident population of great white sharks in the world. I do generally about 2 trips a year there. I've done 20 trips so far over the years. A fantastic place to dive. Socorro, which is also in the Mexican Pacific, and then Key Largo, where I was diving with a group called Force Blue. Force Blue is a veterans organization that helps veterans deal with PTSD and gives them missions to do in diving. I'm the chairman of their board. So does scuba diving have a retirement age? Let's talk about it a little bit differently. And one thing we'll address and this we will address during the presentation, should scuba diving have a retirement age? Now, let's talk about retirement. Retirement is the act of retiring, withdrawing, or leaving, the state of being retired, the act of retiring or leaving one's job, career, or occupation permanently, usually because of age. And so, again, retirement is something we all have to deal with at some point in time, and age is normally the factor. The graphic you see on the right-hand side actually came from an internet search that I did. When I did a Google search, I was looking for something about different types of retirement programs, and Reliance, which is insurance group, their advertising talked about diving into retirement. So diving was the first thing really on their minds. And going on here, hold on a second here, make sure, there we go. Okay, so my retirement plan is to go diving, and I have dived as often as I possibly can. In fact, I was supposed to have been diving over the last couple of months because of the coronavirus. I lost a trip to Tasmania, also lost a trip to Cuba, but I hope everything's going to be back in place for the summer, so I'll get a chance to start diving at least in the fall. Now, when you look at certification cards do not come with an expiration date, even though many years ago there was one. The YMCA Scuba program, when it was in existence, did have a certification card, an entry-level card that did expire after 2 years. And it turned out it was an absolute disaster, so they stopped doing that. And no cards, luckily, have picked that up. So we don't have an expiration date on the card itself. But we all carry, a lot of us do anyway, carry a card from the AARP. And once you reach that magic age of 50, then you start getting inundated with information from the AARP, first of all, trying to make sure that you become a member. And it seems like they're trying to convince you that you're old. So don't pay any attention to them. So mandatory ages in different types of occupations. Pilots, for example, the mandatory retirement age for US commercial pilots is 65. And you certainly don't want to look out the window of your plane and see that. No federally mandated retirement age in Canada. And the reason they had one at one time, but the reason they no longer have one is because the pilots union sued the government for age discrimination. So therefore they took the retirement age away completely. And in fact, a friend of mine is a commercial pilot, and he just finished taking a course called Flying Safely While Aging Gracefully. So that helps him understand the things he needs to be aware of as he's aging. Air traffic controllers, the FAA mandated retirement at 56 with an exception or some exceptions up to the age of 62. And that graphic you can see move, those are planes in flight around the world at any one given time, pre-COVID-19, of course. Retirement age for air traffic controllers in the UK is 60. US federal law enforcement officers, national park rangers, and firefighters, they do have a mandatory retirement age of 57 or later if they have more than 20 years of service. Now, what that implies to me is that they really see the importance of experience, and experience is very, very important for people in those professions, as well as in the sport of scuba diving. Now, the lady on the right-hand side is Betty Reed-Soskin, who was an active park ranger to the age of 96. Unfortunately, the last year or so, she's had a couple of health problems, so she's no longer working full-time as a ranger, but she is still working part-time. And she was actually written up in a magazine because of the fact that she was still an active park ranger well into her 90s. So solo skydiving, the British Parachute Association says to begin skydiver training, solo skydiver training, that means without an instructor with you or out skydiving tandem, sorry. If you are younger than 55 years of age, you can take skydiving lessons. Older than 55, no, because they feel that there's slower reaction time for those over 55, and those over 55 have less acute senses. Commercial diving, there is no mandatory retirement age. There is no maximum age limit, providing all of the medical standards that are required by the Association of Diving Contractors International are met, and those over the age of 35 must undergo additional medical screening every year when they have their required annual medical physical. Airlines, there are exit rules, and exit rules, of course, are designed to make sure that the people sitting in those seats can do what's necessary to get that exit door open and allow other people to get out. So according to the FAA, you must be physically capable and willing to perform emergency actions. And there are people, as you see on the magazine article on the right, that have been denied sitting in the exit row because they were, in quotes, too old. The airline employees must evaluate individuals' physical and mental, I'm not sure how they're going to evaluate the mental capabilities, but physical and mental capabilities and other conditions as they see them. And so if they see you walking down the aisle and having difficulty doing that, just getting down the aisle, and having difficulty lifting your own carry-on luggage up into the overhead compartment, and you are sitting in the exit row, they may ask you to move somewhere else. But they do have the right to do that because the air crew has that legal responsibility. Now, I gave this presentation, actually I've given it a few times, and last week I gave it to a group, and during that presentation I was talking about Silfra. Now, Silfra is the place in Iceland that has the two tectonic plates that come together. And so you literally can be in there and put your hands on both the North American, the Western and Eastern tectonic plates and touch both of them at the same time. And it's known as the crack. And there was a person that I was talking to who said that they were denied access to diving throughout Iceland, including Silfra, because they were 65 years old. Well, a couple of years ago, I heard the same story, and I contacted a group called Dive Iceland, and Dive Iceland told me what the law really says. So the law says all divers or snorkelers must complete a diving history medical statement. That is their own diving history medical statement. Those over 60 must have the statement approved by a physician, because when you look at the medical history questionnaire, and it's available on their website, there is a box that you need to check if you are 60 or older. And if you check that box, then that means that you have to have that form approved by a physician. And so everybody has to fill out the medical statement, and everybody has to submit that if you want to dive the crack or other places in Iceland. But there is no upper age limit barrier. So they're not going to tell you just because you are a certain age that you can't dive there, as long as you have that statement approved by a physician. Now, diving accident insurance, there are insurance plans that do not insure divers that are 70 and older. And so it's a good idea to make sure that you check with your insurer to make sure that your insurance is good for people who are 70 years or older. Now, when you sign up for that plan, there is going to be a question if they can't insure you because you're 70 or older or because of some age limitation. There will be a statement on the material that you fill out and the material that you read prior to agreeing to that policy. And if it doesn't say anything about age in the large print or the fine print, because remember, large print giveth, fine print taketh away. And so in the fine print, if it doesn't say that age is a barrier or limitation, then you should be okay. But it's always a good idea to check with your insurance provider and make sure that you can be covered if you're over 70 years of age. And those requirements or exclusions and limitations are not necessarily because of the insurer. They're because of state or regional insurance departments, because the state insurance department within every state in the United States and many provinces of Canada have the absolute authority to decide who they're going to cover in that state and who's not going to be covered. So it may be due to some archaic rule. And when I was at Divers Alert Network, my wife actually was the vice president of insurance services. And so she dealt with all those state and regional insurance departments. And sometimes their rules are truly archaic and have no basis in reality. And they just decide arbitrarily they want to cover some people and not other people. So just check with your insurer to see what plans are available. And no matter what the insurer is, they generally will have at least one, maybe two plans or so that still will allow you to be covered whether you're 70 or older or not. Now, data is very important. So a lot of times people make decisions on whether people can be covered or not based upon the data that they see. So for example, the British Sub-Aqua Club has a large diving population throughout the UK and throughout Europe, and actually throughout the world, because there are BSHC chapters in various places around the world. But in their diving population, those people that are over 50 represent 16% of their entire membership base or their entire diving population. That same 50 cents, or that same 50%, or 16%, that the group that's over 50, that same group represents 33% of the diving accidents. So 16% of the diving population are over 50, but that group represents a third of all the diving accidents that they have. So therefore, it seems to be that they are overrepresented in the accident population. And that same group represents 50% of the diving fatalities. So just simply looking at that, you would think that there's got to be some relationship between diving safety and age. Well, that isn't necessarily true, because there are a lot of factors having to do with the injuries and fatalities. Some of those are people who have not been diving in years and years and years and then decide to come back to the sport without proper reintroduction to diving. Now, when you look at the DAN data, which I spent a lot of time, because I worked at DAN for a total of 23 years, but I looked at their accident reports regularly and the accident data regularly, and 50% of the fatalities had on record were from the over 40 age group. And approximately 34% of those fatalities were cardiac related, and that number has been steadily going up year after year. And what's really disturbing is 60% of those that had cardiac involvement in a fatality had symptoms that they recognized or the people around them recognized were cardiac related, and they continued to dive anyway and died on the dive. So what that should mean to you and to us, all of us, is that if you are having any kind of a medical issue, then don't dive. If you see somebody who you think is having a medical issue, then by all means talk to them and try to convince them not to dive. So you shouldn't be diving if you have any kind of impairment whatsoever. And divers older than 50 had a risk of a cardiac incident about 13 times higher than younger divers. Now, let's talk briefly about cardiac issues in diving. Diving exposes divers' bodies to various stressors that may contribute to an irregular heartbeat called an arrhythmia. And an arrhythmia can precipitate some more serious cardiac related issues. So the major stressors in diving are, first of all, immersion. Second, exposure to cold. Third, increased work of breathing. Now, when you look at those three, that's diving. And one thing that I talk about both in this presentation and in other presentations that I do are risks and how to mitigate risks. Well, there's really nothing you can do about immersion because diving is being underwater. But you can do things and you can mitigate risk caused by exposure to cold. So that means to have the appropriate exposure suit for the water temperature that you're diving in. And in fact, when we were diving in the Antarctic, most everybody there was using a heated undergarment with heated gloves to reduce the risk caused by exposure to, in that case, extreme cold. Increased work of breathing. What that means is that if you're doing a lot of work to breathe, there's something wrong with the equipment that you're using. And so make sure that you take your regulator periodically to your local dive store and have it tuned properly so you can reduce that risk caused by increased work of breathing. And other things are things, for example, like emotional stress. One of the big issues right now, in my opinion, is that there are baby boomers who started the diving industry, but they got certified years ago and they haven't been diving in a long time, sometimes 20, 30, or even 40 years. And now they want to come back to the sport because they now have time on their hands and they have, family has left the house. And so they're able to spend time doing the things they want to do, including diving. So you want to make sure that you take it slow and easy to get back in the sport. You can't necessarily come back at the same level you were at 10, 20, 30, or 40 years ago. So emotional stress can also precipitate those arrhythmias and then lead to a cascade of events that will ultimately result in a cardiac issue. So signs and symptoms of cardiac related injuries, for example, like a myocardial infarction, which is a heart attack, they're actually just about anything and everything. Pain, fullness, and squeezing sensation of the chest, jaw pain, toothache, headache, general ill feeling, nausea, vomiting, sweating, whatever. All of these things are things that could be signs and symptoms of a cardiac event. And so if you have any of those or any time you don't feel like you're well enough to be able to dive, then don't dive. I'll simply say, just sorry, I'm not going to do it today. And about 25% of those people that died with a cardiac event had no signs or symptoms whatsoever. And they were totally unaware of the fact that they had a pending cardiac issue. First aid for heart attack, remove the diver from the water. CPR, of course, and an automated external defibrillator if it's available. I have that in yellow because they're not necessarily available at all dive sites. When I first started at DAN back in 1991 as an employee, my job was to develop a training program at DAN. My job was to create programs, as Joanne mentioned, the oxygen program. So I created the DAN oxygen program, and one of our mantras was that we wanted to see oxygen at every dive site and on every dive boat. And it happened. Luckily it happened, everything went well. Same thing goes, in my opinion, for AEDs. They should be available on every dive boat, at every dive resort, and hopefully at most of the dive sites. Because the fact that when you look at the average age of the diving population, it's well over 50. And so you need to make sure that you have the equipment there if they need it in an emergency. And then contact the emergency medical services in your area or wherever you happen to be able to get that person into the medical system quickly. So let's define age. There is something called a chronological age, and that is your actual age by your birth date. And that is your real birth date and the birth date you're willing to tell people. Life expectancy in the United States for those born 100 years ago was 53.6 years for men and 54.6 years for women. Now, life expectancy for those born in the US in 2020, 76 years for men, 80 years in Canada, 81 years for women, 84 years in Canada. And so therefore, our life expectancy is significantly longer than it was 100 years ago, and we're hoping that it'll continue to increase. And there are things that we're going to talk about here that you can do to increase your life expectancy. And we were never born with any sort of an expiration date. So, I mean, I've looked, I don't see any barcode anywhere. I don't see any numbers anywhere that would indicate what my expiration date is. And I'm hoping it's many, 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 many years from now. I'm hoping yours is many, many, many years from now. There's also something called a physiological age, and that's based on your physical fitness. Now, again, think about these things. These are things that you can change, your health status, and your cognitive function. So a lot of those things are things over which you have some level of control. And there's something called a psychological age, and that is just the term old. And again, I think that's what the mission is of the AARP, is to convince you that you're old. And I don't want to be convinced by anybody that I'm old. So old is a set of self-chosen attitudes, perceptions, and expectations. So what you expect to do, how you perceive yourself and the attitude that you have, and that's going to affect your psychological age. And of course, the AARP keeps talking about older people, and unfortunately, they've never had a diver on their cover. I'm hoping one of these days one of us shows up on the cover. But also, I was reading an article in the AARP News, and they were talking about the fact that age was categorized. And they had what was called young old, who were people from 60 to 69, middle old, people from 70 to 79, and old, people who are 80 years and older, which makes absolutely no sense to me. Why would people want to categorize themselves, especially as being old? So don't do that. You don't need to do that. Now, one of my favorite quotes is a quote from Satchel Paige, who was a pitcher in the Negro Baseball League many, many, many years ago. I actually had an opportunity to see him play when I lived in Florida years ago. But his quote was, "How old would you be if you didn't know how old you are?" Which is really interesting, because if you didn't know the year you were born, if you didn't know when you were born and didn't really know how old you were chronologically, how old would you think you were? And I would almost bet you that all of us would think that we're at least 10, maybe 15 or 20 years older than what our chronological age happened to be. It's kind of like the movie Crocodile Dundee. You know, when they asked him when he was born, he said, in the summertime. And he didn't care what the year was. It made no difference. And I think that's what it really should be. It should be irrelevant. Now, age-related data from the diving community. This was done a number of years ago by a group called scuba.com. And it was something where they looked at the age distribution. And you can see that almost 2/3 of the active divers in the diving world are over 40 years old. And that number is increasing all the time. In fact, if you've been diving within the last 6 months or so, and being on a dive boat or being a dive site, you look around and the average age around there could be in the 50s or even higher. In fact, I was on a boat trip not too long ago where I think the average age must have been in the 60s, because there were a number of people there who were celebrating their 70th birthday. Now, facts of life. These are things that we can't get around. These are facts of life, but they really affect people differently. And these are just general statements I'm going to make, but they affect everybody differently, because again, a lot of that age is based upon your physical fitness and your nutrition and a lot of different things that we can control. So most organs begin to lose function at about 1% a year, beginning at around the age of 30. But most of these changes don't become apparent until after the age of 70 or even later than that. So there are people, for example, like Stan Waterman. Stan Waterman celebrated his 90th birthday dive, actually in Guadalupe. We were out there diving. He was doing cage diving. And he's kind of like a rock star. He's a rock star in the diving world, but kind of like a rock star. So when he does his farewell tour lasted for at least a year. So he was celebrating that birthday for an entire year as he went diving all over the world. And the facts are that changes that we experience may, and it's underlined in yellow, may affect performance. They don't necessarily affect performance, and they don't affect our performance equally. So each of us are affected differently. They affect and may affect judgment and reasoning. And judgment and reasoning can improve with age because, as we talked about earlier, we have experience. We have a lot of experience, and that experience can help us make good decisions and help other people make good decisions. Now, what I like to consider what the Marine Corps says about how to adapt and compensate for any decrements you experience, not only in body function, but anything. Anytime you have a decrement or a disability or a disadvantage because of something, then you can, first of all, understand what it is, understand what your limitations are, and you adapt for that disability or decrement, and then you overcome it by improvising. So for example, if you have a problem with vision, you wear prescription lenses. If you have a problem with hearing, you don't have to hear much underwater. But if you have a problem with your ears, then you can use Doc Pro plugs or a variety of other things that can help you deal with ear problems. So there are a lot of things you can do. And of course, we know there are a lot of people who are disabled who dive regularly and dive without any problem at all, because there are programs that help them understand how they can adapt and overcome those disabilities. Now, increased potential for chronic medical issues. One other fact of life is that our immune system changes as we age, and we sometimes become more susceptible to some chronic medical issues. For example, having joint replacement. In June of last year, I had a full knee replacement, and I understood what I had to do and listened to my physician's advice. I listened to the medical advice from the folks at Divers Alert Network. And about 3 months later, I was on a dive trip, and everything has worked out well. I've been on a number of dive trips since then. So there's no real problem with a joint replacement as long as you follow the appropriate medical advice. In fact, when I looked up joint replacements on the internet, what I came up with, the first thing that popped up was this photograph of a diver. So, and it's one of the most common questions that people receive at Divers Alert Network. And you need to make sure, of course, it's all done correctly. You don't want to have a botched job that's going to affect your ability to continue in the sport that you love. There are also other medical issues. When I was in the military many, many years ago, I was exposed to Agent Orange. And as a result of that and a number of other things, I ended up with cancer and had to have that treated. I had surgery done. They didn't get it all. So I actually had to go through a whole series of radiation therapy treatments. And one thing I did at the end of my last radiation therapy treatment, I asked if I could lay there in my diving gear, and just to demonstrate that even things like cancer are not going to keep divers from the sport that they love. And I posted on my Facebook page, and the lady on the right-hand side had just finished her last chemotherapy session, and she did the same thing and posted that. So this is just an example that even grave medical issues are not going to keep you from diving. And of course, there are a lot of questions now about COVID-19, and there's a lot of information going around about that. So let's talk about some of the body systems, your muscles and skeleton. And again, these are facts of life. So as you age, there's decreased strength and mobility. And again, that's a broad statement because it's going to be different for different people depending upon your level of fitness. Decreased flexibility and joint range of motion. Again, it's another broad statement. Increased susceptibility to injury and longer recovery time, which is a fact of life. If you injure yourself, it's going to take longer to recover. In fact, that photo on the right-hand side, I was actually on a liveaboard in the Turks and Caicos, and somebody had just put some very slippery material at the top of the ladder, and I slipped and fell down to the deck down below and broke a couple of fingers and had a cut in my elbow, but no noticeable brain damage. And luckily, the crew had just finished their day first aid course. They patched me up, and everything was fine. Increased muscle stiffness after activity. Again, that's a general statement, but it can happen when you dive. Diving considerations, movement from place to place. And think about this, about the diving that you do. So you've got to move from place to place, from the place where you have your gear configured to the entry point. You have to move back to the place to take your gear off. Range of motion to lift and put your equipment on, take your equipment off. All those things are very, very important. And you have to make sure that you have the ability to do that. And so having a range of fitness is a good idea. And also different types of fitness is a good idea to keep yourself in good shape. Enter and exit the water is something you need to worry about. And this is kind of this photo on the right is kind of a pet peeve of mine, that you have somebody climbing the ladder with their partner being way too close. If that person fell back in the water, they'd land right on that buddy of theirs. And the person climbing up the ladder took the regulator out of their mouth. It should be in there until you're actually up on the boat, because if you fall back in the water, you don't want to have to be struggling around trying to find that regulator to be able to breathe. And mobility in the water. You need to make sure that you move and can move down the anchor line or down the down line, down to the dive site. And if there are things like that, and I like to conserve my energy, so when I get in the water from a dive boat, I'll go to the anchor line and go down the anchor line, so that way I can stop any place along the way if I want to by just holding onto the line. And if there's a current there, I can pull myself down without having to kick the whole way. And diving consideration, again, deficits may be mitigated with exercises to maintain joint flexibility, muscle strength, and aerobic capacity. So it's always a good idea to try to use the same muscle groups that you're going to be using in diving. And it's always a good idea to be reasonably physically fit when you dive, and make sure you take some sort of fitness program.
interjecting you?
That guy was having a very bad day. So sometimes physical fitness can be a real problem. But here I am, actually, this photograph was taken in the Bahamas. I was diving with the gentleman who's behind me. We're doing our safety stop. That gentleman is Dr. Jose Jones. He's the co-founder of the National Association of Black Scuba Divers. And you can see that he's 85 years old. You can see he's in that full lotus position because he's extremely flexible. And you can see in that photograph that I'm not, because I'm not nearly as flexible as he is. But it's a good idea to take things even like yoga. I mean, those kind of things are very, very good to help you be able to relax and help you to be able to have that joint flexibility that's so important in diving. Now, what accommodation can be made, because we know these things are true as we age, ask for help. So if you're on a dive boat, there are people there that are there to help you. So make sure you take advantage of that. Choose easier equipment configuration. So if you don't want to have this tanks on your back, then use side mounts if necessary, and that could help. Or you can even do different types of diving. So for example, if you have a back problem, you have some sort of problem where you don't want to have those tanks on your back, you can even do things like Stan Waterman did, and that is to do that last year of diving, do cage diving, because that way you can still be underwater, still breathe through a regulator, but you don't necessarily have to swim. And so that's one of the things he chose to do, because he wanted to still be underwater. Take it slow and easy. Move at your own pace. My partners and I, when we dive, we don't keep up with anybody. We keep up with each other. We need to make sure that we understand before we go diving that we move at a very, very slow pace, because we want to be able to enjoy the sport. And it's not a race. Dive your recent experience. Your recent experience is extremely important because it gives you the tools and knowledge and experience to be able to handle problems that occur during a dive. And dive your experience, not your certification card. The certification card is only a ticket to be able to dive. It has nothing to do with your diving ability. For example, my brother and I both took our first certification course in 1964, and we both got the same certification cards. We both carry the same certification card. In those years, 50 some years, my brother's made probably a total of maybe 50 open water dives. I've made well over 10,000. And I dive regularly. So my recent experience and my experience in general is far greater than my brother. So my qualifications, even though we're certified at the same level, my qualifications are entirely different. Okay, heart and lungs, talk about those. Heart becomes a less efficient pump. Now think about this in relation to your body absorbing and eliminating gases. So you breathe in gas, your body absorbs nitrogen, eliminates nitrogen, and nitrogen is the offending gas in decompression sickness. Maximum heart rate decreases as you age. Your vital and ventilatory capacity decreases as you age. Body requires more oxygen to do the same amount of work as you age. Decreased tissue perfusion, or those gases getting into and out of your tissues. Fat stores and metabolism all change as you age. Increased risk of hypothermia as you age. I'm not sure where these people were diving, but the guy probably had a headache on top of it all. Possible increased risk of decompression sickness because gases go into and out of your body more slowly. Diving considerations. Actually, this is a photo where I was diving with Dr. Sylvia Earle, and at the time she was 82, I think 83, and she's still very, very actively diving, and she is living proof that age is no barrier. Decrease in performance. You know that's true as you age. You get tired faster, slower to recover. What accommodations can you make as a diver? Ask for help. So again, if you're on a boat, people are there to help you. Take advantage of that opportunity, or have your partners, your diving companions help you. Move at your own pace, not someone else's. In fact, I was diving in Japan a couple of years ago, and the dive master kept coming up and scolding me the entire time during the dive because I wasn't moving as fast as she wanted me to move. And I said, it's too bad. I'm still going to move at my pace. Conserve your energy because you want to be able to dive as frequently as you want to. Take frequent breaks. There's no need to dive the 5 or 6 dives a day that they allow you on certain liveaboards. boards. And select proper exposure protection because you want to make sure that you're comfortable regardless of the water temperature. This was a picture we were taken when I was on the Antarctic trip. That's in Antarctica. It's a wreck called the Governor Norrin. And that was a whaling ship that caught fire in 1906. They intentionally grounded it to make sure that they could save the whale oil and save all the passengers. And the water temperature there, by the way, was 30 degrees. Nerves and senses, improved judgment and reasoning ability. Of course, that's an individual thing because we all know that some people, regardless of age, don't have good judgment or reasoning ability, but you can have improved judgment and reasoning ability as you age. Decreased near object visual acuity. So you know that once you reach around 40, your arms aren't long enough to read any longer. So you'll need some sort of assistance to do that, like glasses or a prescription lens. Decrease low light and color perception, that changes as you age. Decrease auditory acuity. You lose about 10 decibels of hearing ability with every decade of life. Decrements in balance, spatial orientation, and coordination, because you have to be able to get up and move around, especially a rocking dive boat. So it's always good to be aware of all of those things. And slower reaction time. So you react more slowly as you age. That's simply a fact of life. Diving considerations, it's harder to see your gauges because, again, sometimes the font is just simply not large enough to be able to read that correctly. You've probably seen people with cell phones. As a friend of mine who does not wear glasses. She refused to wear glasses. And when I looked to borrow her cell phone once, I saw the largest font I'd ever seen in my entire life. I mean, it was huge. And so if you need glasses, by all means, wear glasses. Now, harder to hear and understand pre-dive briefings as you age, especially if the pre-dive briefing is done by someone where English is not their primary language. Sometimes it's difficult to understand some of the syllables, and so therefore you need to make sure that if you have any questions about the briefing, ask those questions. Harder to negotiate dive sites, especially when you have a shore site where you have wave action or rocks or anything else. Plus, you may have to swim across the surface for some distance against wave action or wind or currents. Increased difficulty in emergency response. I mentioned before, you react more slowly as you age. What accommodations can be made? Move closer and ask questions during the pre-dive briefing. So if you don't understand something, make sure you ask questions. The dive masters will be happy to answer questions for you. Review your dive plan before diving to make sure that all the people you are diving with are on the same dive plan and it's fully understood all of those things that are important about the dive. So when to communicate about your air supply, when to communicate when it's time to turn the dive to go back to the surface. Or write your dive plan down on a slate. There's nothing wrong with doing that. There are a lot of people that do. I do that myself occasionally. Use prescription lenses if you have a hard time seeing. Be more attentive as a buddy. So you know your reaction time is slower, so therefore be more attentive. Sometimes be closer to your partner to make sure if something happens, you're there to assist. What accommodations can be made? Assure a clear entry path to the water. Again, because that spatial orientation may be difficult to help you maneuver back to the entry point. Be situationally aware. Be aware of all the things that go on around you during the dive. For example, your bottom time relative to your dive plan, your depth relative to your dive plan, breathing gas consumption relative to your dive plan and your diving partners, your workload, where your buddy is, location of your entry and exit point. All those things are important. If you happen to make a mistake or have something go wrong during the dive where you go deeper than you should, you can always shorten your bottom time and lengthen your safety stop. You can, if you're working too hard, then your body is absorbing more nitrogen and that's going to increase your risk. And you can help mitigate that by shortening your dive, diving shallower, and extending your safety stop. So there are a lot of things you can do, but you've got to be aware of all those things during the dive. Your glands and skin, lower metabolic rate, reduced tolerance to cold as you age, coupled with reduced tissue perfusion. Again, that's going to affect your body's ability to absorb and eliminate gases. Decreased stress response and reaction time, as we talked about, is slower. Again, slower reaction time, as we talked about. Altered drug and alcohol metabolism. I'm sure you've traveled to resorts where you look at the bar and it's as though some people had never seen a bar or alcohol before in their lives. And they tend to overdo it sometimes. One thing you have to realize as you age is that your body does metabolize alcohol, and generally takes an hour or so to metabolize an ounce of alcohol when you're young. It takes longer as you age. Plus, once you metabolize the alcohol, your body has to break down all those waste products. And so it takes longer for you to do that as you age. So you need to be very conservative about your alcohol use and drug use. Your skin atrophy, decreased tolerance to insults as you age. So you need to make sure you have the proper sun protection. Sweat glands shrink, reducing your ability to sweat and your ability for your body to manage internal temperatures. Diving considerations, poor tolerance to cold. So make sure even in what you would consider warm water, 80-degree Caribbean water, for example, is still 20 degrees colder than your body temperature. So make sure that you have the appropriate exposure protection. Increased likelihood of dehydration. So you look at the signs of dehydration in the list there in that graphic. Lightheadedness, fatigue, impaired mental focus. A lot of those things are serious safety issues in diving. Decreased saliva production. as you age. So if you do clear your mask with spit, you may not be able to do that. In fact, there used to be an old philosophy many years ago where they said, if you can't spit, don't dive. And the reason for that was that is also related to stress. So if you're under emotional stress, then sometimes you have dry mouth. And so therefore, it's probably not a good idea to dive if you're under stress. But now, of course, it has to do with aging as well. Increased likelihood of heat-related issues because your body is having a hard time dealing with internal body temperatures. What accommodations can be made, correct exposure protection. Here I was diving in the Cayman Islands, 80 degrees. I'm still wearing a wetsuit because I like long bottom times. I want to make sure I have the correct exposure protection. The second photo there in the center is a dive I made in Ushuaia in southern Argentina before I went to the Antarctic because I was using equipment that I had not used before. And I wanted to make sure I was diving under very, very controlled conditions to make sure I knew how the equipment worked and how I worked with the equipment to make sure everything was comfortable before I tried doing dives in the Antarctic. And so we went from 80 degrees to 36 degrees. And of course, I'm wearing a hood, which in most people's terms is probably the most hated piece of equipment ever designed. But wearing a hood is a good idea. And I've known people even diving under the ice when I worked in Ohio many years ago that refused to wear a hood. And I think that's just insane. And then we were in the Antarctic. The water temperature was 30 degrees. We were diving and trying to dive as comfortably as could, but they also did what's called a polar plunge where people went swimming in 30-degree water. No, thank you. Now, hydration is very, very important. So hydrate, hydrate, hydrate. And the American College of Sports Medicine said before you do any kind of physical activity, you should consume 16 to 20 ounces of water or non-carbonated, non-caffeinated, non-alcoholic beverages at least an hour or two before you do that activity. And then 16 to 24 ounces after the dive or the activity is over to rehydrate. And you know you're hydrated when your urine is clear and copious. And there are people who intentionally dehydrate themselves so they don't have to pee in their wetsuit or dry suit. Accommodations can be made. Use sunscreen, sunblock liberally, at least 30 SPF or higher. And also it's a good idea to use sunscreen or sunblock that's protective of the reefs. So make sure that is what you're using. Drink alcohol in moderation and watch your drug intake. Again, you're not in your 20s any longer generally. And so therefore you need to make sure that you understand it takes a long time for your body to metabolize that alcohol and then metabolize and rid itself of those waste products. Use mask clear if necessary. And that'll help you. That way you don't have to spit into your mask. The stomach, intestines, and bladder, alterations in digestive and urinary tract function. Those things change as you age. Decreased saliva production we talked about. Increased time for your kidneys and your body to rid itself of waste and metabolize drugs and alcohol and remove those intoxicants from the body. So if those intoxicants have not been removed adequately, you don't feel well, and therefore it may compromise your safety as a diver. Reduce hormonal response as you age, impaired ability for your body to conserve salt. That could increase your risk of dehydration. So if you look at the ones that are highlighted there in yellow as the performance decrements because of dehydration, an 8 to 10% decrement in reduction in performance, reduced stroke volume of your heart, reduced cardiac output, less oxygen, and electrolyte imbalance that could lead to cramping. So none of those are good. And also you need to be aware of the fact that hydration is extremely important and something you should do before and after the dive's over. Bladder capacity decreases and your aim may not get any better. It's really kind of tough, if you have to go in dry suit. When I worked at Florida State, we were doing extremely long cave dives to do some work for the hydrology department at FSU. And we would actually be in the water sometimes for 5 hours or more. And so wearing diapers was something you had to do. Urination frequency increases, and that's true as you age. Watch what you eat. And believe it or not, there are people that eat things like pork grains and milk gravy, or if you travel, you may be eating things that are totally unknown, or you may think you're eating one thing when you're actually eating something else. Food can affect your performance during a dive. That's one thing we talk about, my partners and I, before we dive. Make sure everybody feels good, everybody's comfortable, everybody's well hydrated. And over on the right-hand side, one thing that I do, I have a personal habit of doing a safety stop on the descent. I always do my safety stops on the ascent, but I do a safety stop on the descent because I want to stop 10, 15 feet or so below the surface, just to look at my buddies and say, are you okay, before we continue on? Because if there's an issue, I want to know about it that early, rather than waiting till we get all the way to the bottom in 50, 60, 70, or 80 feet of water, and then ask, are you okay, and get a signal I don't want to see. So that's just a personal habit of mine. Now, to pee or lie about peeing in your wetsuit, if you have to, you have to. It's a little bit tough in a rental suit because you have to turn that in when that's over. So it's a good idea to try to make sure that you are well hydrated and pee if you have to. Alteration in the ability for your body to metabolize drugs. We've already talked about that. What accommodations can be made? Avoid exotic foods. Hydrate, hydrate, hydrate. Again, being hydrated is really a good safety factor. Performance for a dive boat with a head. I always would like to be on a boat where there's a head, just in case I have to go, so that way I don't have to worry about going in the suit or jumping overboard and going in the water there by watching. And again, reasonable alcohol consumption, and understand you're not as young as you used to be. And of course, alcohol can be a real serious problem, safety issue in diving. Diving consideration, dive activity should match your level of fitness. And again, try to use those muscle groups that you use in diving, and your mobility and strength and your ability to fin. And again, those same muscle groups that you will use in the physical fitness that you do is really going to be important. And remember, annual physical. Everybody over the age of 45 should have an annual physical, preferably from someone who has an understanding of diving medicine. And that photo is Steven Tyler from Aerosmith, just turned 72, and he is a diver. And so that annual physical is very, very important. So over the age of 45, or anytime there's a sudden change in your health, you should have a physical. And you should visit a diving medical professional, if possible, who understands your life priorities. It's very important that your physician understands how important diving is to you, because that way they won't make a blanket statement like the physician did when I first talked about why I developed this program. So that way your physician knows that diving is an important part of your life. And they can't simply say, no, you shouldn't go diving anymore. And if your physician needs assistance in understanding what they should be looking for, they can always talk to the medical department at Divers Alert Network, or Dan has a diving physician referral network. All you have to do is call them. They can give you the name of a physician with any specialty all over the country. There are over 700 physicians in their physician referral network. Now, older divers should adhere to safety and conservative practices, and that's being ultra safe with all of that breathing gas. And dive more and worry less. Diving is something that, of course, will take some of that emotional stress away. It's good for you. It releases all those positive hormones that are good for you and good for your body and good for your longevity. Dive within your limits and experience. Dive your recent experience, not your certification card. As the graphic shows on the right-hand side, recently practiced skills and experience are essential, because underwater, that certification card is going to be no good at all to you if you need something to happen and need to be able to deal with the situation. Only your recent skills and experience are going to be able to give the tools and knowledge to solve those problems. Avoid diving conditions that may exceed your recent experience. I was diving in Socorro about 2 years ago, and my partner and I got up, stood on the back of the boat. We were looking at the conditions. It was about a 20-knot wind blowing, 6 foot or so swells, and the wind was blowing the tops off those swells. And we looked around and looked at each other, and at the same time said, nope, not today. So we just chose to set out that dive. It was much better later in the day, so we were able to do a dive that day anyway, but we chose not to do that one because it just didn't feel like it was our day. Use nitrox with air computer or dive tables. This is something I recommend for literally everybody, but especially divers over 50, that I think you should be using nitrox mixes as air with your air computer or table. So my dive computer, I do not change it away from the air setting, and I don't dive air anymore. I dive nitrox on every dive. And so it is a good safety factor. And in fact, it's used so frequently by older divers now, it's nicknamed geezer gas. Now, when you look at this, it'll give you an idea of what I'm talking about. Air on the right-hand or left-hand side, nitrox 32% mix on the right-hand side. The no decompression limit for air going to 60 feet is 60 minutes. Nitrox limit would allow you 100 minutes. But if you use it as air, then you're going to be limiting yourself to 60 minutes of bottom time, which gives you a 40-minute safety factor. So using a nitrox mixture with air tables or a dive computer on the air setting will result in less nitrogen that your body's going to absorb during the same amount of bottom time. Safety consideration, get proper training, make sure that you are nitrox certified. Always analyze your own breathing gas, limit your depth because it's not a deep diving gas, it's a relatively shallow water diving gas, generally limited to 100 feet or shallower. Know your maximum operating depth, and you get that information, of course, from the course you take, and it's not a deep diving gas, as I mentioned. And oxygen toxicity will be something that you will learn about, and depending upon the number of dives you do, it could be an issue. And of course, in any kind of diving, regardless of what you do, don't push your limits. So older divers should use the most conservative options, and on the left-hand side, every single dive washes my spirit clean, and hopefully it does the same for you. Practice slow ascents, including safety stops, and remember, a safety stop is at least 3 to 5 minutes, or it can be longer if you choose. And so if you want a longer safety stop, there's no reason why, as long as you have the proper amount of breathing gas, there's no reason in the world why you can't lengthen your safety stops. Be situationally aware about the things going on around you. Carry surface signaling equipment. You see my partner and I, the guy on the right-hand side, my partner had a very, very tiny surface signaling kit, and I'm using the Dan surface signaling kit, which is the one I helped develop. What's unique about the Dan surface signaling kit is not the fact that it's much larger, but the fact that it has a metallic strip built into it that's visible on a radar, which we think is a very important safety factor. Or you can use a surface float, or there are electronic devices, for example, like the Nautilus Lifeline. If you get separated from your boat, you simply push a button on that device and it sends a signal to all the boats within a certain area around you that indicate there's a man overboard and gives your exact position where they can come and pick you up. Take a break after multiple dives and multiple days of diving. Don't be afraid to ask for help. Have an easy exit ladder with a pull-up bar. You can don and doff your equipment in the water if you want to. And don't be afraid to say no. Remember, one of the most important things you can remember as a safe diver is you can always call a dive at any time for any reason. That's one of the most important things I learned in cave diving. When you raise your thumb, you're not saying, hey, this is a cool dive, and it may be a cool dive, but you're saying the dive is over. So once that thumb comes up, the dive is over. And I've done that actually even before the dive starts. So if I feel I'm not prepared for the dive for some reason or other, then I'll raise my thumb, dive's over. And you make sure you talk to your partners. And when I'm diving with people, that is something that we talk about, and we all agree that when the thumb is up, dive is over, no discussion whatsoever, and the dive is over, return to the surface. So what do we do here with longevity? Mount Sinai did a longevity study a number of years ago. They found out that your genes have an effect and impact on your longevity, and it results in about 30% influence. Your lifestyle influences 70% of your longevity. And so your lifestyle is something you can change, something you can affect. Bottom line is have the right attitude, stay active, and do the things you love and love the things that you do. Result, higher quality of life, increased longevity. So things to do to increase your longevity, find your tribe. There is life-giving power of social interactions, even though now, of course, we have to worry about social distancing. And social distancing is something that the sport of scuba diving invented. And we do it, and we do it well. And eat smart. Make sure that you understand obesity is a serious problem in diving and causes a higher risk for cardiovascular disease and type 2 diabetes. And a body mass index, a relationship between your height and your weight, greater than 35 can reduce life expectancy by as many as 8 to 19 years. That was actually a study that was done in Canada a number of years ago. Recommendation, downsize your dishes and watch what you eat. Seek a purpose, have a purpose every day. When I retired from Dan, people said, don't retire because you're going to die. Well, that's because people a lot of times retire and have nothing to go to. Well, I had a lot of stuff to go to. In fact, now I'm busier than I ever have been. I do almost all volunteer work. And one of the volunteer things that I do is being the chairman of the board for Force Blue, which is a veterans organization that does environmental work, including planting corals in the Florida Keys. And having a sense of purpose might contribute to longevity by lowering your stress hormones. So dealing with kids, helping to introduce children and people with disabilities to diving is a fantastic way to spend your retirement. Move it, move it, move it. Adopt a lifestyle that encourages activity. I wouldn't recommend that you run with fins on, but doing things with fins on could certainly work. I wouldn't necessarily dance with fins on, but so adopt a lifestyle that encourages activity. Can older people manage the physical and mental requirements associated with scuba diving? Of course they can. This is a photo I was diving with Ernie Brooks, a photographer, the Ansel Adams of scuba diving. He specializes in black and white photography. I was on his 85th birthday dive with him, also in Guadalupe, and he's still diving actively. If you hear that music, older people can recognize that music. That's the theme song from Sea Hunt. And over on the right-hand side, you have Lloyd Bridges and his co-star, Jael Perry. And Jael Perry is an active diver. And I was diving with her in Guadalupe, or not, excuse me, in Socorro, where they have the giant Pacific manta rays, and she was enjoying every single dive. And she is ageless. I would never divulge her age. Then there's people like Pat Fung, who's an instructor candidate at the age of 75. And we have Roy Woolley from Malta, and he is Europe's oldest active diver, 96 years young. He dives regularly on a wreck called the Zenobia in Malta. And then we have now the world's oldest diver is actually an American, Bill Lambert, who started diving when he was 97. And the dives pictured here, he was 99 years old. So should scuba diving have retirement age? When it's time to hang up your fins, the decision is a decision only you can make. And it should be made when diving is no longer fun, or when you feel you may put yourself or others at risk, or when you can no longer conduct a self-rescue or assist in the rescue of a diving companion. And when you make those decisions, they should be made with a physician's advice. And again, a physician who's familiar with diving medicine and your life priorities and your overall health. And be realistic about your capabilities as a safe diver, because only you can make those decisions as to whether you're going to dive or not. And you want to make sure you don't put someone at risk because you chose to dive when you shouldn't. Now, when you get ready to cross that road, make sure you do it as a diver. And I'm going to show you a video here. And this video clip, all the people in the video clip are over 80 years old.
I do not play bingo. I am not shrinking. I'm not strong for my age. I'm strong.
I will retire for the night.
I will begin again tomorrow. I will always respect my elders.
I am wrinkled and I am gray.
But I'm not old.
That's fantastic. So safely enjoy scuba diving regardless of your age, and it should not be a barrier. I wrote an article about the ageless diver. It was published in Dive Center Business Magazine. My email address is there. And if you would like a copy, simply send me an email and I'll be happy to send you a copy of it. And that's the book that Joanne was showing in the very, very beginning. And so the coronavirus will pass. It may pass like a kidney stone, but it'll pass. Any questions?
So folks, you're welcome to either come off mute, or if you want to ask them in the chat room. I do have a couple of questions already, but we'll have time for more. So if you want to write them in the chat room, please do. So one of the questions, you talked about insurance, and some of the insurance companies don't have an age limit, or they do have an age limit. Does Dan's insurance have an age limit?
They did at one time because of a couple of states where the state insurance department decided that they would no longer allow insurance to be sold to people of certain age groups. And I believe all of that's been corrected now. But even when they had that, it was only one of their plans. It wasn't all the plans. So the thing to do would be, if you did not receive a letter, and if it affected you, you would have received a letter or an email directly from Dan telling you about that issue. And so if you didn't receive that letter, generally it's a problem. And it would not have been a problem anyway, except for renewal. So your policy would have stayed in effect.
But if you have questions, yeah.
But if you have questions, I was getting to that. But if you have questions, then what the thing to do is contact your insurer, whether it's DiveAssure or Dan or anybody else. And they can do it. But generally they would be required by law anyway to let you know that you didn't have coverage.
Perfect. You mentioned knee replacements. Someone said, I need to check with Dan for any information about stem cell treatments in joints. Do you know anything about stem cell treatments?
I don't, but they would have the latest information, and whatever information I would have wouldn't necessarily be recent. And one of the things that Dan does is they make sure they have available all the current research and all the current published papers on just about every topic. And what they can do is send you copies of that literature, or direct you or your physician or your orthopedic surgeon to the right place to find out what they need to know. And I did tell my orthopedic surgeon before I had the knee surgery that I was an active diver, just so he was aware of it.
Sure, of course. So maybe you shared this, but I didn't quite catch the age. What is the oldest person you have dove with?
That I've dove with?
Yeah.
Well, Stan Waterman was 90. I've been diving with Ernie Brooks a number of times. He's now 87. But 90, I think, probably is the oldest.
Okay. The gentleman you mentioned in the United States, he's actually from Illinois, I believe.
Yeah, Bill Lambert.
And I met him last summer, and he was getting ready to go on his next year's dive. Yeah, yeah. He dove in Pearl Lake. He dove in Pearl Lake, which is actually quite close to us here in Iowa.
Yeah, in fact, I wrote to the dive store, talked to the dive store about it, and they said he really was having a great time. He was 97, and he was doing it all himself. So he wasn't having people put his equipment on, take it off. He was doing it all himself.
Yeah.
Great guy.
Yeah, he was loving it. He was loving every minute of it.
Yeah.
So talking age, how old were you when you started to dive?
The first underwater experience where I breathed through a regulator, I was 11, and that was in Florida. I wasn't certified at the time. There wasn't a certification card available or a dive store available that I could find. So a friend of mine actually had purchased some equipment, and we experimented with it, but that was before certification.
Yeah.
But I got certified in 1964.
Okay, perfect. Have you heard of World Nomads as a travel insurer? Do you know about them? Are they reputable?
I've heard of them. I don't know anything about them, but there are a number of companies like that around. There used to be Thomas Cook, but they're out of business now. But World Nomads, I'd do a couple things. First of all, I would do a Google search of them to see what the comments are from various people, to see what they say about any claims that were submitted. And I would then maybe ask for a copy of the policy and read the policy, especially the fine print, to find out what the exclusions are, because sometimes it sounds good, but the exclusions are horrendous and make some insurance policies worthless. I mean, one of the things we wanted to do when I worked at Divers Alert Networks was to make sure that our policy was as easy to understand and as easy to use and as diver friendly as we could possibly make it.
And if anybody, so did you ever run into a dive operator who is not comfortable diving with you due to your age? Have you heard of this? And if so, if it does happen, do you have a recommendation on how to handle it?
No, I personally have not. But I do know of people that have run into situations where they were told that they could not get on the boat. I was actually talking to some people that said they were on a cruise, and when they tried to sign up for one of the excursions, they were told that that particular dive location had an age limitation, and if you were over 60, they wouldn't take you. I have not gotten any independent verification of that. I've been on a couple of cruises myself, and I've never run into that. But you're probably going to run into dive operations like that, that just simply, what they may say, rather than simply no, they may say you have to have an approval by a physician. So one thing that I would suggest doing, there really is no travel medical form that's available that people can use when they travel. There is what's called the RSTC medical form that's on the WRSTC.com website that you can download, take it to your doctor, have your doctor fill it out, and you can carry it with you. It's the same form you would use if you were taking a course, but at least it's some verification that a physician has said that you are in good enough condition to dive. And I would have that renewed annually.
Yeah, that's perfect. And for anybody on the call, that website works. That's also the same form that we use in the store. So if you stop in or ask the store, we can send it to you, because that's the same form we use for classes.
Yeah. Yeah. In fact, actually, they're coming up with a revised form too.
Okay. I have just one more comment. Is there any more questions from anybody? That I think you can take yourself off mute if there's any questions. I don't see anybody doing that. The last comment I have here is this is a fantastic presentation, Dan, from Tom Shropshire. So many points that we currently use at Off the Wall Divers, and so many additional great points.
Good, good.
I would add, I have to say, you taught me something. I did not know that you have an increased likelihood of dehydration, decreased saliva, and less ability to sweat. I did not know those three things. So the dehydration one really surprised me. I did not know that. So
yeah, it's a real problem that people will indeed intentionally dehydrate themselves so they don't have to pee in their wetsuit, and that's a real problem.
But I didn't know that as you age, you're more likely to get dehydrated easier. That's new for me. That was new.
Yeah.
Well, Dan, this was truly wonderful. I appreciate your time. I hope you'll do this again for us someday. This was wonderful. Thank you so much.
I've got some other presentations, so all you need to do is ask, and I'll be happy to do it for you.
Wonderful. You have a great evening, and thank you everybody for attending. And we have another session next Wednesday, so join us then. Thanks, guys.
Yes, stay safe and healthy.
Stay safe and healthy.
Okay. Bye-bye.
Bye.